Let's get into the recumbent. Walk me through recumbent in terms of a potential ACL tear or knee injury or hip injury and just getting started.
Well, with most cycling type motion after injury and after surgery, cycling is really a wonderful activity because you can use the bicycle to reestablish range of motion.
Mm-hmm.
When we start out in a very short arc implies that it's a usable range of motion.
Mm-hmm.
Usually people, once they come out of the procedure, can generally move their leg from almost full extension to about 90 degrees.
Mm-hmm.
But getting more than that is a really important aspect of some of that early rehabilitation, which is in like the first 2 weeks, first month. So to establish our best range of motion or the reach of the device from where you're sitting, you can put your heels on the pedal and pedal backwards, if you will. I mean, this assumes that you have two healthy legs.
Yeah.
But actually, for the person who's been fresh out of surgery, they want that condition to occur where the heel reaches the pedal with the leg almost fully straight. Mm-hmm. Now this will be sometimes difficult to assess if a person doesn't have good quad control to where they can hold their leg straight.
Mm-hmm, mm-hmm, mm-hmm.
So you may have to kind of guess. Nonetheless, if you put slide your foot a little bit more towards the middle there. Now early on, say your knee doesn't want to bend so much, putting the foot at the middle of the pedal will be a little more comfortable and confident, which is important.
Yeah, yeah.
So when we start pedaling, we're going to go around this way, and this leg is doing the driving. As this comes up in through here, you'll find your stretch point right there. Hold it for a second or two, and then you can come back around the other way. Again, left side here is doing the driving and pushes that right leg up to its stretch point. Hold for a second or two, and then you can go back and forth. So this is one way of doing some stretching. Mm-hmm. But if you want to then do just like some basic oscillatory moves or just moving this forward and back just to get a little more fluid motion in through the knee, this is a really easy forward and back type motion, and it'll be really quite satisfying for a person to do that. Give them a greater sense of confidence. And also when we start doing this, we're getting the muscles to contract, relax, which is an important part of overcoming that muscle guarding process, or those muscles holding on for dear life.
Exactly. Perfect.
Which happens.
And then we can get them to the point to where they can
eventually, So when that foot slides back to where we've talked about before, where we place our first metatarsal head just forward of this pedal spindle, that actually at our point of most extension, which is right out there, makes a little more of a knee angle than if you were to move the foot a little farther forward. So it does create more knee bend, which ultimately we want to do to a point in our rehabilitative process, and is more of a natural cycling motion anyway.
Perfect.